Hello again. You've made it through half the course. We're ready now for you to begin with some specialized techniques and learn about certain conditions and techniques that will be useful as you implement instructional programs in the integrated educational settings. Students with significant disabilities, those with low incidence disabilities, have more frequent health care needs than the general population. The purpose of this module is to establish how you can provide quality health care in an educational setting. Now, you might ask yourself, I'm not a nurse, I'm not a doctor. Why should I be providing health care? Well, you will not be providing specialized interventions and procedures that you aren't trained for, but you will be assisting, and you must recognize signs and symptoms when healthcare procedures are needed to be implemented. Sometimes, in order for a student to function well in a general education classroom, you will be asked to do non-specialized procedures for which you have been trained. I want to caution you, if you are ever asked to do a medical procedure, please be sure that you have received the proper training to do that procedure, and please be sure that you're following all of your district's policies regarding your provision as a teacher of medical procedures. Now, in order to maximize educational opportunity for children with low incidence disabilities, sometimes those special healthcare procedures will need to be incorporated in the educational day. Additionally, you may be asked to watch for things or do things that actively prevent the development of related health problems and conditions. For example, procedures that should be part of your training and everyone's training include infection control, first aid, and CPR. Also, you should be familiar with information regarding seizures and what to do with seizures of different types and frequency. You should be aware of medication issues and how they might affect the educational performance of your students, along with the type, purpose, and schedule of the administration of those medications. You should also be aware of any potential side effects that medications may cause. You are the eyes and ears for the medical team during the day. It's not a responsibility to be taken lightly. Of course, in your records and in cooperation with the other team members, you're going to have emergency numbers for family members, the medical facility that the family might be using, and the primary health care provider. You may also need to know specific protocols for the implementation of healthcare procedures for certain individual students, because sometimes the person primarily responsible for implementing procedures may not be available. It's a heavy responsibility, but not one that I'm not convinced you are prepared for. Students' health care needs are best addressed, again, through the collaboration of family and school personnel. The family, of course, will communicate with the doctor, as will perhaps the school nurse. When everyone is clear on why a particular procedure is being done and how it's to be done, then the implementation of the individualized educational program will flow more smoothly. In this module, I'm also asking that you read not only Snell, but a chapter on feeding in the other book, Best at All. Feeding for a given student can be a specialized procedure. In this chapter, I want you to pay particular attention about how to prevent aspiration, how to make sure that good nutrition is getting into the student, and the methods and means of providing adapted food and adapted eating techniques to students who have, in particular, motor disabilities. Enjoy the reading, the module, and I look forward to reading your reflections, and I look forward to hearing your feedback on special health care procedures and feeding.